Hi, my name is Mirelle Rojano, and I'm originally from Mexico. My family and I immigrated to the United States when I was about 8 years old. So from Mexico, we moved to Texas, and currently I attend the Katz School of Medicine in Philadelphia. Growing up in Mexico, I saw how my parents really trusted the physicians that worked there. I think a lot of it had to do with the fact that they spoke our language, they understood our culture and values. Most of them were like friends, like family friends. And I noticed a really big change once we moved to the United States. Suddenly, my parents didn't feel like they could trust the doctors they were going to. There was a lot that was lost in translation when we first arrived here. And even like the customs and cultures that we have weren't really appreciated by the doctors they saw here. And that really motivated me to want to be somebody in the United States that other immigrants and Latinos feel comfortable coming to and receiving the proper care that they deserve. As someone that can speak their language, understands firsthand how it feels to be an immigrant in a different country, I feel like I can provide that for them, and that's why I want a career in medicine. So far, what has got my attention the most is family medicine. I think I just like the idea of being one of the first doctors that a patient sees. Because I want to have such a positive impact in that patient's life, I feel like being the first physician that a patient sees means a lot to them. If that patient has a good firsthand experience, the likelihood they'll come back for more medical treatment, keep up with their appointments is much higher just because they feel comfortable with you. I like to think I'm a very approachable and friendly person. I think that by being friendly and approachable, people feel more comfortable around me. I feel like the first step as a doctor is to always make your patients feel heard and understood. In particular, with like Latino patients, me speaking their language and like also being an immigrant myself, I feel like I can relate to them on a fundamental level. And once we have that going, it can be easier to kind of talk to them more about their medical conditions and make sure they understand exactly what is going on with them. I can speak for a lot of medical students when I say that medical school is really expensive. And then, especially if you come from a background where, not the most wealthy community background and there's no physicians in the family or anything like that, it can be very hard to even know how to apply to medical school, let alone figure out how to pay for it. So I like ElevateMeD's mission of wanting underrepresented people to be doctors. I think that's really important, especially living in a country where the underrepresented minorities are actually becoming a lot more prevalent. So we need a lot more doctors that look like us and that speak our language to be around and provide medical care. And I think with ElevateMeD being a part of them, it can really help me reach those people that also might need help in starting a medical career. To those that are like the sponsors of ElevateMeD and donors, I would just like to say thank you, because any amount of financial help honestly goes a really long way for us that are in so much debt. And I think, a lot of us went into medicine knowing it was going to be expensive, but we figured that it was worth it if it meant that in the future we could cause a really big impact in somebody's lives. So, thank you.